The following is a paid program for the BC Chiropractic Association. Please consult with your family chiropractor regarding any questions about this program.
But they've had this pain start and it's never gone away and they need some help.
I didn't think that, 6 months down the line I'd still be feeling pain.
They thought it was all in his head.
If at the end of the day that person is told it's in your head and it doesn't exist, you're simply being misdiagnosed.
I was terrified of surgery because I didn't want to have failed back surgery.
Some chiropractic procedures could have been used much earlier in this patient's history that could have avoided all the ongoing cost to the medical system.
Who knows what's going to happen once they start going inside there with a knife.
Every year, millions of people visit a healthcare professional for spine-related injuries. I'm Dr. Lydia Michelson. The cost to Canada's healthcare system is in the billions of dollars, and it's under attack. From threats of privatization, from higher costs, and from accusations of declining standards of care, chiropractic doctors are working towards solutions. They're addressing the shortage of doctors and the challenge of lowering healthcare costs. Join us as we take a look behind the backs of chiropractors. We'll look into misconceptions and preconceptions of care and current problems of our healthcare system. We begin with a story of two people, both with spine-related injuries, both facing surgery, and both who ended up on different roads to the same place.
I work in a warehouse and I'm performing my duties. I have to pick up cases of golf balls and put them on a cart in order to take and pick the orders.
I was playing soccer and I suffered an injury. I was tackled from behind. I felt immediate pain, which over the course of that day got progressively worse.
And when I picked them up and twisted, I felt something pull. I felt an injury.
By the next day, the pain was so severe that it was to the point where I felt nauseated.
Well, I went to my family doctor, and after examining the symptoms that I gave him, the pins and needles and the loss of strength in the hand, the shoulder was very, very sore. After his diagnosis, he decided that maybe there was a problem with the shoulder, so he would give me anti-inflammatories and painkillers and see if it would take its course in 2 or 3 days.
I went to see my family doctor because the leg pain had become unbearable. In fact, I could hardly walk. And so I went and I saw my GP, who then tried to make arrangements for me to see a neurosurgeon fairly urgently.
The only option that I was given was they were going to have to recommend surgery, and which would mean opening up the throat through the front to get at the discs and to do the work that way. And they recommended that I get on the waiting list immediately, and which was 4 months at that time. Because my case was quite severe, things did roll along pretty quickly in terms of knowing that I needed to have surgery. So I went and saw the neurosurgeon who did a CT scan, and we did surgery within 2 weeks.
Second opinions. Patients are entitled to second opinions, and they're also entitled to opinions from other healthcare providers. And unfortunately, when you get the prospect of surgery, usually it's given to the patient as a last resort, and there's nothing else they can do when they haven't been presented with an option of chiropractic care, which may be very effective in avoiding going that route.
Spending on healthcare has increased each and every year. Higher costs are all we have to show for it. Government health budgets in BC are now approaching nearly half of the total annual budget expenditure. These costs will create a new economic crisis without improvement to patients' health. Spending more money each year has obviously not improved Medicare. Patients of chiropractic say their pain symptoms dramatically decrease within a few treatments. Those facing the prospect of weeks or months away from work often return to work sooner after seeing a chiropractor. We have the right to choose, but often we are not aware of the choices.
I was afraid of having surgery because I was afraid that it was going to make me worse than I actually already was.
And then the thought of them having to open you up with a knife. I mean, who knows what's going to happen once they start going inside there with a knife. So yeah, that was pretty scary, pretty low.
The problem is people are not getting the right diagnosis, the right form of health care. They're suffering needlessly. They're experiencing medications and surgeries unnecessarily. And they're doing so because the information about how the body functions, how the health professions interact, and how they provide health services to the patients is bad today. And what we have to do is educate the public to how the body works and how it can be treated and how they're going to get better.
Well, I feel that there's far too many cases of people being over-medicated, surgery rates are too high for conditions that will respond very well to chiropractic care, but there's segments of the population that never get exposed to chiropractic care and don't even know that that option exists.
In compared to any other treatment, I think chiropractic is one of the safest.
Chiropractic care has been documented or experienced or proven or shown, however you want to describe it, as being the safest form of care for spinal problems. Risk problems exist in all forms of health care. Those are known to the profession, those are advised to the patient, and they're also identified to the patient in terms of the potential risk ratio, whether it's 1 in 1,000 or 1 in a million or wherever it is. But we know categorically that the treatment procedures that chiropractors perform have a much safer risk factor than the daily common use of anti-inflammatory surgeries or other processes that are done.
The pain was really intense constantly. I was taking medication that I had to go into my doctor or to emergency to get refilled every 3 to 4 days. I couldn't do anything. My whole left side of my arm, shoulder, hand, all I could do was hold it in like a sling-like position. They recommended that I put a collar on the neck to immobilize the neck. So there I was for like almost 4 months waiting for this surgery date.
Patients aren't really even aware that they're not being fully informed. Patients aren't really being made aware that they have choices. One of the fundamentals of healthcare is informed consent. Those people who are taking drugs unnecessarily, those people who are going to have surgery that haven't tried a chiropractor, those people who were going to have surgery, went to the chiropractor, and the condition is resolved. Amongst other things, they're obviously happy that their life is back to normal. But there's also a very fundamental issue here of informed consent, standards of care, negligence, practice standards. These issues aren't addressed because, again, the patient isn't really empowered to address them.
My name is Dr. Jean-Sébastien Bidouin. I conduct research at the School of Human Kinetics at the University of British Columbia. Our goal is to better understand spine and spine-related injuries at the nerve and muscle level. It's an extremely complex subject. We're on the leading edge, discovering new answers every day. Research is the foundation to help people. If we further understand spine injuries, we can help people.
The Canadian Chiropractic Research Foundation proudly supports research at the University of British Columbia.
Why is the public not aware of the benefits of chiropractic? Perhaps one of the reasons lay in a continued misbelief that health care must be provided primarily by a medical doctor. Doctors of chiropractic receive more extensive training and education on spine and related care than any other health profession. It takes 7 years of study and practical experience to become a chiropractic doctor. Side-by-side comparisons of medical students and chiropractic students reveal that the average number of classroom hours is nearly the same. Patients are just not fully informed that their choices include chiropractic. Our story continues with Larry on the brink of surgery and Dawn enduring post-surgery complications.
But because of the surgery, because they removed the disc and basically, I guess you're basically making the bones aren't in alignment anymore, and they're closer together because you don't have that disc there cushioning that space. So ultimately what I was left with was this back pain that would not go away.
The irony is that if you go in with surgery and take away a part of a disc or part of a bone, you haven't changed the underlying reason why that structure failed, leading to surgery in the first place.
You can't really do anything that's pain-free. Everything is impacted by that pain. That is chronic back pain. And it affects your dealings with people because long-standing pain is going to make anybody feel cranky and short-tempered. It's frustrating.
I was sitting having coffee one day and a friend of mine came in and looked at me and he said, "Hey man, you look terrible. You really look like you're hurting." He says, "How about I recommend something to you?" So I said, "Well, listen, anything that might alleviate some of this." So he said, "I've got a doctor that I'd like you to see, a chiropractor."
I myself was a little bit skeptical. I felt that it looked scary to me. It looked barbaric to me, and I didn't have an understanding of what a chiropractor actually did and what they could offer.
Chiropractic is very simple. It's the treatment of 24 bones of the human body, the nerves that pass through there, and the human conditions and health problems that arise from it. Chiropractic is simply the treatment of the movement of those vertebrae to restore the normal nerve function and help the body recover.
The potential for chiropractic goes way beyond the spine and back pain. The spine is the vehicle that we use to access the health of the total person, because your spine houses your nerve system, your spinal cord. And when you have problems in your spine, not only can you have back pain, you can have disruptions anywhere in your body.
But there's an awful lot of people who come in and they just never thought they could get the relief that they got. And I think there's a lot of people out there with their back problems, and as I often say to my patients, sometimes you don't know how bad you are with your back problems or neck problems until you feel better. And once you feel better, you realize what you've been putting up with for so many years and the kind of headaches or neck pain and back pain or other conditions that you've been tolerating all this time that you didn't need to tolerate.
I noticed some immediate relief right away. He told me to go play the next game and come back again between games for another adjustment, which I did. I again noticed improvement. I was shocked. I was absolutely amazed. I had almost spontaneous resolution of my back pain that day.
If you're dealing with it before surgery and you look at that patient's spine, you will find that in the area, whether you x-ray it, it'll be very clear. If you don't x-ray it, the anatomical knowledge is still there anyway. You're dealing with two joints whose weight bearing is now abnormal, meaning they're compressing the nerve and blood vessel and tissues on one side. And secondly, the lack of movement is going to compound that and continue it on. The treatment from the chiropractic perspective is very simple. You're simply restoring the movement of the joint, and in that process, the patient's symptoms will recover.
He did an adjustment, said, "Come back tomorrow." The next morning when I got up, I thought, hey, my hand, don't have quite as much pins and needles in the hands, and my wrist is not as sore. There might be something to this. So I went back, did the second visit, the second day, did another adjustment. Says, phone me in the morning. The next morning I get up, I have a lot more feeling in my hand. My elbow, I can move my arm. I'm thinking, we're on the right track.
After I went back and had the second adjustment and realized, wow, this is really helping me, I felt elated to be free of that pain. Even if it was going to only be for a week or two, I felt elated. I felt like I could fly. To be free of that pain, even if it was only going to be for an hour, it was an amazing feeling. As it was, I've had pain relief for 4 months now from that adjustment.
The issues in healthcare always come down to two things. The knowledge of the public as to what to do for their health problems and who to see. That's one problem. The second problem is the competition in the health industry for status and economics. It's well written, it's well documented. If 30% of people are experiencing one clinical condition called low back pain, never mind other health problems arising from the human spine, but just take one clinical condition. If 30% of those people are going to some other health practitioner and they end up going to a chiropractic doctor, that has a huge economic effect in the health industry, and that's going to drive barriers to patients' choice.
Choice is imperative. However, when it's a medical emergency, choices aren't always possible. However, if you do have a choice, then you need to look at all the options that are available to you.
If I hadn't have had the friendship to say to me, listen, you know, you have to go and see somebody else before you go under the knife. I might have gone down the wrong road. I mean, I may have gone in and had surgery and it wasn't necessary. They were going to have to cut my throat and come in through the front and open it up and repair the discs from the inside. That didn't sound too good to me. He said, I want you to come over and talk to him, see if he could maybe do something. And he did an adjustment, and each day the symptoms got better and better. I think I want to cancel that surgery, let somebody else do it that needs a surgery.
Visit your family chiropractor today.
Spinal problems, including common back strain, can leave people with debilitating back pain. They are often put on the wrong road to recovery. It's not the quality of health care given. In many cases, it may just be the wrong treatment. In our next story, Vera was involved in a minor car accident. Her next few months were a trial of pain and frustration. Frustration from coping with her life and with the health care system.
Well, I was stopped at a red light, and all of a sudden I was hit from behind by 2 cars. I was just in shock. I didn't know what had happened. A couple of minutes later, I got out of my car to see the damage, and it didn't look too bad. The other cars were damaged more than I was.
We find that far too many people leave things far too long. They'll put up with their neck and the back pain for weeks, months, and in some cases even years before they consider having something done about it, which makes it very difficult to get the optimum results that we could get if the patient came in as quick as they possibly could when they noticed the onset of their problem.
After going to see the doctor and a few sessions of physiotherapy, I still didn't think it was a big deal at all. I thought it would go away because I'm young, and I'm healthy, and I thought it was just a muscle spasm and it would just clear up on its own, but it didn't.
A lot of these patients come in after these minor rear-end accidents with their neck pain, and they've been misdiagnosed as having muscular strains and treated that way, and of course they will not get better. Many of these problems actually have subluxations, problems with the alignment or the mobility of the spine, which irritates the nerves, which are the master controlling network for the muscles, and the muscles are then responding to the irritation of the nervous system. So when a chiropractor looks at cases like that, we're more interested in the relationship of the spine and the vertebrae as it relates to the nerve and how that controls the muscles, because the muscles are really only the symptom. They're not the cause of the problem.
Medical doctors are not trained to check for subluxation, and they're told not to refer to chiropractors.
In every office, you'll find a superhero. Wherever there's a box that's too heavy. Wherever there's a shelf that's too high. Wherever there's a photocopier that needs to be picked up.
Bob? Bob! I said, would you help me move some boxes?
You don't have to be a superhero. Back strain and injury is only one way to ruin your day on the job. Know your limit and think twice before lifting once.
This message brought to you by your BC chiropractors.
Spinal conditions comprise 1/3 of all daily healthcare utilization. On-the-job back strain injuries accounted for 22% of all claims received by the Workers' Compensation Board. This translates to over 500,000 days lost on the job in a single year. The cost to the healthcare system, the employer, and ultimately each of us is in the billions of dollars. It's a looming problem, both financial and health-wise. The landscape of Canada's healthcare system is changing. Higher costs will be passed on to the public, directly or through company healthcare plans. At the forefront is the BC Chiropractic Association, participating in solutions for affordable and effective healthcare. Regardless, someone who is off work with a spinal injury may only have a portion of their wages covered. They suffer because of their injury, and eventually they suffer financially.
I was loading luggage, and I picked up 2 suitcases, and I guess I twisted wrong while I was loading them and hurt my lower left back.
We've known from studies that the workers' comp itself in BC has done since 1975 that the fastest, best outcomes of the treatment of spinal problems come from chiropractors. And that means to the patient, less time off work, to the compensation board and the employers, lower costs of compensation.
There were times where he couldn't get out of bed because he was in so much pain, or he'd be up through the night because he couldn't lay in bed all the time. And, you know, and every time he turned, he was just flinching or groaning because of the pain. And painkillers weren't helping. He was on all sorts of things, and he's not one that he likes to take a lot of different pills and that, but, you know, he was trying everything that they could try for him, even up to T3s, and nothing was doing, you know. That would only be temporary relief, but they said it was all in his head.
If at the end of the day that person is told it's in your head and it doesn't exist, you're simply being misdiagnosed. It's as simple and blunt as that. The doctor you're seeing, the therapist you're seeing simply doesn't have the knowledge, the skills, isn't going to tell you they don't have the knowledge or the skills, but has to tell you something. So they blame you. The reality is, the wrong doctor, the wrong diagnosis, you've just been misdiagnosed.
Money problems started because he wasn't getting, you know, his full, you know, work wages and stuff. He wasn't able to go to work, and he was doing light duties, and he wasn't doing his full capacity. It was really hard on him, and you could feel the stress. There was stress between us, and there was stress with him, and, you know, he's feeling frustrated, and things weren't working out for him. And
so the following week I seen the specialist, and I did the full scenario with the specialist and went through all the tests and everything else like that, and the specialist said immediately, you won't be capable of going back to work for a minimum of 2 months.
Contrary to what is often said, most people do not want to go on time loss. Most people do not want to stay off work. It's not a lot of fun staying around the house with pain, and most people, contrary to the reports you hear, are not malingerers. They genuinely want to get well and do so quickly and get back to their life.
Well, when a person comes into our office who's been injured at work, their biggest concern is that they want to get back to work as quickly as possible. But they want to go back to work and not be in pain and not be fearful that they're going to hurt themselves again.
If I was talking to the people in charge, I would tell them that they're missing a big opportunity to improve the health of the public and lower costs in terms of health care in this province.
The public is the loser in two ways. One, they have poor health because they have the wrong treatment, and because of the costs associated with wrong treatment being high and lack of recovery adding to those costs.
Well, first of all, many people don't know that they are covered through WCB, and they can come to see us first after an injury, and they get very good coverage.
Patients are very surprised to find out that they don't need a referral to see a chiropractor for ICBC car accident cases or for work-related WCB injuries. Then there's also those patients who have no coverage, and even then they're quite surprised that the amount of money they're paying for chiropractic treatment is still relatively small.
And again, a lot of people don't know that they have extended medical at work, and a lot of plans, again, have very, very good coverage. But people's extended plans, they don't tell them that. A lot of people don't know, and so as they say, if you check your extended plans or ask about WCB or ask about ICBC, call your chiropractic office first. They'll be able to tell you a lot of times what's covered.
The greatest untapped resource in healthcare is the consumer. Well-informed patients get better care and also assist in better prevention. The issue at hand is how to get the right information into the hands of the right person at the right time. Under the current healthcare system, chiropractic doctors do not have the same access to diagnostic equipment as provided to medical doctors. In the case where chiropractic treatment may result in the best outcome, the patient's choice is restricted to what is covered and what is not. For the patient, that financial choice may result in a longer recovery time and higher costs to the healthcare system. Higher costs in medications, surgery, multiple visits, and insurance claims. For those that have the ability to make a choice of chiropractic, the results are more than often astounding.
I was skeptical at first and even a little scared. I didn't know what to expect. I'd never had this kind of treatment before.
Chiropractic adjustments are remarkably safe. When we compare, almost any medication has side effects. 30% of people that take a medication will have some sort of a side effect. The complications from chiropractic adjustments, which are given to millions of people annually, are very, very minimal.
Treatment generally is not painful. If you come in pain because you've left your problem so long that you're in pretty bad shape, we'll do our best to keep our treatment as gentle and pain-free as possible. But if you're coming in pain, there's not going to be some miracle occurred that you're all of a sudden going to walk out without having pain. That kind of thing takes time. But treatment does not hurt.
My chiropractor, he was really good. He explained everything to me. He told me actually that my injury was more serious than I had thought before. And he gave me exercises, and I saw him first twice a week, and then progressively I had to go less. And I just got better and better, and now I feel almost as good as new.
Within my first appointment with him, I had instant relief. It was great. It was the first time in a year that I actually felt really good.
I see definite improvement, almost as good as I was before. I no longer feel pain in the morning. I can do exercises again. I can walk.
How do you get a good chiropractor? Usually family, friends, acquaintances, co-workers, people who already have a family chiropractor. 42% of the population has one. It's not going to be hard to find who they've been satisfied to see.
Chiropractic care is probably the best treatment for neck, back, spine, nervous system related disorders because no other profession has the amount of in-depth training to the spine than chiropractors do.
If they have a pain, whatever that human dysfunction is, if it's not resolving in 2 or 3 days, call up their family chiropractor, have a consultation and treatment if that's what shows up. For those people who are generally what we'll call healthy and they don't seem to have any aches, pains, ailments whatsoever, a visit, whether it's every 6 months or 18 months or 2 years, is something they should consider just as a checkup, just as an evaluation and assessment of their spine to determine what else they can do for prevention. Again, we know everybody's going to have a spinal problem. It's a question of when.
The future of healthcare is in your hands. Your Health is a cooperative effort by all healthcare providers. You, the patient, have choices, and those choices should not be restricted. Your health is our responsibility, and we are accountable. Your choices begin with questions, to yourself and to us. We welcome them. Visit our website at bcchiro.com. Thank you. I'm Dr. Lydia Michelson. Backpacks that are too heavy or not worn properly can lead to health problems for your child. Choose a backpack with a lot of pockets and wide, padded shoulder and hip straps. Pack only what your child needs for that day and show them how to put it on and wear it properly.
Pack it right. Pack it light.
For more information, contact the British Columbia Chiropractic Association or visit bcchiro.com.